just wanted to talk to y'all a little bit about drug addiction because everybody knows someone who has some sort of addiction, whether it be food, drugs, alcohol, cigarettes, or anything else. And if you don't know someone like that, well, now you do. My name is Konarik, and I'm an alcoholic, a recovering alcoholic. I've been sober for 5 years in February, and alcoholism and addiction run in my family. They have for generations, so it's something that's a serious topic to me, and it can be too often a deadly disease. So I want to inform you all about what addiction is, what can cause it, the symptoms of it, and how it can be treated and possibly even prevented. So what is addiction? From medicalonline.com, it's defined as the loss of control over the use of a substance, and it's a neurologically based disease, so it is based in the brain. There are 4 categories of drugs. We have depressants, which slow down your nervous system, so alcohol, marijuana, Valium, Xanax, and any kind of sleeping pills. Then we have stimulants, which do the exact opposite, so caffeine, nicotine, cocaine, meth, ecstasy, inhalants, which would be like sniffing glue or pain. We have opioids, and that's where you're going to find your heroin, morphine, codeine, hydrocodone, and such, and these are known to be the most addictive drugs and the hardest to get off of. Hallucinogens are going to be LSD, acid, peyote, mescaline, and psychedelic mushrooms, and these do the most damage to your brain. So what are the causes? Well, it's generally inherited. From National Institute on Drug Abuse, once this disease is triggered, it can cause permanent neurological changes. But the environment also has an effect. So if you're raised in a home that's loving and nurturing, then you're going to be less likely to reach for that alcohol, which is going to trigger your disease, versus growing up in an abusive home life where you're going to be having added stressors in your life that are going to make you want to use some substance to get away from that situation. So the brain chemistry of addiction from medicalonline.com. Addicts have cravings that have to be met because this desire is an electrochemical neurological brain impulse. Again, it's in the brain. Addicts lose the ability to choose to use. So your drug of choice is actually just a symptom of the disease. It's just a way to try to treat the disease. So how can you tell if someone is addicted to a substance? Well, there are some symptoms, mild to major dysfunction in everyday life. So if you have trouble getting or keeping a job, if you're having trouble with relationships in your family or your friends, and if you have mental or physical health problems like forgetfulness, inability to think clearly, a cloudy mind, not sleeping, sleeping too much, or losing or gaining too much weight, all depending on what kind of drug you're taking. If the loss of teeth and sores on skin is going to be a sign of methamphetamine abuse. The inability to stop on one's own is also a sign. So if someone wants to stop but they literally cannot stop on their own, then they're addicted. Withdrawal symptoms when one does try to quit. So withdrawal symptoms would be flu-like symptoms when trying to quit heroin, digestive upset, seizures whenever you stop drinking abruptly, and hallucinations. You could also have dementia and confusion or not recognizing familiar people. And it's important to say here that you can not quit any of these substances abruptly without talking to your doctor because some of these side effects can be deadly, especially seizures. Tests can be performed by doctors to see how severely internal organs, especially your brain and your liver, have been affected, and this can also tell the professionals how long you've been abusing a substance. So what can be done to help treat or prevent addiction? Well, thank goodness there are many things that can be done. According to the online journal Addiction, rehabilitation centers, so inpatient treatment and outpatient treatment. Inpatient is going to be anywhere from 30 to 45 days in an environment where you're there all day, all night. They also have 3, 6, 9, and 12-month stays, or you can stay for even longer depending on your individual situation. In outpatient treatment, you're going to go in during the day, and you're either the day or the evening, and then you're going to be able to go home at night. You can do 12-step programs and anonymous meetings, so AA, NA, CA, any kind of addiction pretty much has an anonymous meeting out there, so that's always a great option. You can get treatment from a psychotherapist. Cognitive behavioral therapy is basically what they're going to do, and it helps the patient recognize their triggers, which is a person, place, or thing that makes the abuser want to use that drug or alcohol. Other drugs can also help with withdrawal symptoms, so you can use a nicotine patch if you're trying to quit smoking, or antidepressants and mood stabilizers. Prognosis and prevention. So typically a combination of all three approaches works best. That's what worked for me and continues to work for me. Prevention is just educating people, educate your children, teens, and just don't be afraid to talk about it. So here we have some faces of addiction from msnbc.com, and this kind of shows you before and after of what drugs does to people. And it's pretty shocking to see that in such a short period of time, these people have changed so much. You can see the dates at the bottom of the screen. This guy, 11 years, looks totally different. And this is my sister Katie. This is her before shot, and this is May 2006. She had just graduated high school and had her life ahead of her. And her after shot is May 2007, just 1 year later. She died of a drug overdose. So you can see that this is near and dear to my heart, and I just wanted to try to get the skills out to help identify addiction and help you with your family and your friends if you think someone is addicted. And if you need more information, you can go to www.samhsa.gov. It's the Substance Abuse and Mental Health Services Administration, or you can call their phone number. So hopefully this has been helpful to you and maybe help save some lives. Thank you very much.